Hi, I'm Dr. Nikolai Lennox, and I'd like to talk to you about knee pain. Now, this is going to be a slightly different view of knee pain than the orthopedic injury that happens so often. This has to do with all the things that happen before you get the orthopedic injury, because it's really rare that a perfectly balanced knee will suddenly get injured. It can, but it's really rare. So what I want to talk about is those things that contribute to stability of the knee and instability of the knee in a way that you might not have thought about yet. So we know that muscles surround the knee, right? I mean, I can list them for you. You know, there's a sartorius, there's a hamstring, there's the quadriceps, there's a tensor fasciae lata, there's a gastrocnemius, soleus muscles, just to impress you that I know these things. But more important than that is that each one of those muscles is on a specific circuit in your body that relates to an organ system. And that organ system relates to nutritional circumstances and nutritional deficiencies and dietary stuff, as well as emotional kinds of relationships. So, if we sort of take the big knee injury out of this discussion, we'll talk about things that make your knees hurt. My knee hurts because. We wake up in the morning and you walk, and over a few days you notice your knee hurts, knees pain. So, what I want to tell you is how I look at that. So the first thing we're going to do is to examine the muscles that support the knee. So there's a way which we do muscle testing, isolate those muscles and evaluate those muscles and identify which muscles are not firing efficiently. Now, you know, the nervous system is such a wonderful thing that automatically muscles fire according to the stress they're under. And they do that based on a feedback system. But there are things that will interfere with that feedback system. And those things can be all the way from minor trauma to shoes, to emotional attitudes, to dietary shifting, and my job is to figure those out. For example, there's a muscle right behind the knee. It's called the popliteus muscle. And that muscle prevents hyperextension of your knee. So, if your knee is allowed to hyperextend, then of course it irritates it. And there are other muscles that then tighten to try to compensate for that. So when we look and we see the popliteus muscle not firing the way it should, the first thing we start looking at is the gallbladder circuit. When we start looking at the gallbladder circuit, now we're talking about digestion, now we're talking about diet, and oh yes, we're also talking about emotional stresses, because the emotional stress, kind of like resentment, can adversely affect your gallbladder, and the gallbladder can set you up for a knee pain. The other thing is the sartorius muscle. We talked about the sartorius muscle when we were talking about adrenal stress. The sartorius muscle lays in on the middle part of the knee, comes all the way up to the hip, and that's on the adrenal circuitry. So if you have adrenal fatigue and your adrenals are unhappy with how things are going, then what's going to happen is they're not going to fire properly, the sartorius muscle won't fire properly, and you'll have a little medial knee support problem, have a circumstance where you can easily injure the middle part of your knee, but you may also have back pain. A lot of times we have digestive stress that will affect the knee. There's muscles on the side. We all know about the iliotibial band. That's that big long band on the outside of your thigh that goes down to the knee, and that's involved with the ileocecal valve, which is an intestinal valve. That's involved with the large intestine, so digestive problems can precipitate stress into the knee. The other thing that can happen is you can be up on your toes for a period of time. You can be going up and down ladders, and you will over-exercise calf muscles. If you over-exercise calf muscles in the presence of imbalanced muscles like sartorius and popliteus and tensor fasciae lata, then what happens is you get the pain. A normally balanced muscle group, a normal joint, won't give you pain when you do things like that. It'll just give you muscle fatigue. So what we look at is we look at the balance in the joint, the muscles that support the knee. Are you in fact having a diet that's full of junk food? Have you been on a chocolate binge? Did your best friend come back from Belgium and bring you the best chocolate ever and you just ate it day after day after day? And after 3 or 4 days of eating chocolate, you noticed your knee was hurting. These are the kinds of things I look at, because We want to get to the bottom of what your body language is talking about. Have you just taken a new job? And in that job, there's a circumstance where you just can't quite get around it properly and you're resentful about it and it's irritating you and it gnaws at you at night. And then in 3 or 4 days, pretty soon, you have a problem with your knee. That's an emotional stress that precipitates into it. Do you maybe have a thyroid issue that happens? Thyroid issues affect fat metabolism. Fat metabolism affects knees because of the popliteus muscle. So, I just want you to know that when you bring me a pain in the knee, this is the kind of thing I think about. I'm thinking about you and your knee, not just knees. What is your body talking about when it's producing an imbalance in the knee? What does it want to discuss? And how can you and I together address that and make some solutions for your health? Thank you.